welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of KevinMD. Today on the show, we have Dileep Kumar. He is a hospitalist and he wrote an article on KevinMD about the CDC's continuing failures. Dileep, welcome to the show.
Thank you.
We'll get into your article in a little bit, but first off, can you just share your story and journey to where you are today?
So I grew up in India and I finished my medical school there. And then I worked which is in Middle East for a few years. And then I traveled to UK and Ireland for some studies and courses and things like that. And then I did a residency in Cleveland. And then I started working as a hospitalist in Michigan. So that's the story in a nutshell.
All right. So we are speaking in the beginning of February. Tell me, what are you seeing now on the hospital floor?
Oh, we have lots of, especially in Michigan, we have lots of COVID patients still. Our ICU is full. And one of the major things we are noticing that majority of patients are not vaccinated, because that's the truth. And I would say that the numbers are high and the mortality is the same, like the worst part of COVID, which we had in 2020, it's almost like a second act, so it's sad actually, because still people are dying. It's a struggle for everyone to deal with the situation, all the providers, even the physicians, and even the nurses. The nurses especially work in the ICU, they're very stressed out. Burnout rate is very high. People are leaving. So yeah, it's really surprising that we're still dealing with this after 2 years.
And when you talk to these patients who are unvaccinated and are in the hospital, do you get a sense that some of them have any regret about not receiving the vaccine?
Yeah, they do. Some of them actually, a lot of them have regrets, and so I'll ask them. I just curious, and I ask them why you did not vaccinate, and it's because of the misinformation. Because of what other people tells, and then some are sorry, some are like, okay, I'm going to take it soon. But there are still some people, they won't take, no matter what it is, they're not going to take the vaccine, and they do not want to hear about anything else. But some are really, kind of sorry for that. And then, so as a physician, compassionate physician, my approach is to not to judge them, offer whatever we have, and support them.
All right, we're going to talk more about public health messaging as it relates to the CDC. Your KevinMD article is titled "The CDC's Continuing Failures. Is There a Way Out?" Now, for those who didn't get a chance to read your article, can you just walk my audience through it and share the story of why you decided to write it?
Yes. I mean, as you know, during the past 2 years, we have seen a lot of recommendations from CDC, which are controversial, or even we were doubting why they were saying like that, because starting from the mask. So you get mixed messages. And I think that also kind of confused the whole COVID situation and might have led to the current situation. So my concern was, I think the CDC came out with the recent regulation about the shortened and quarantine, which, they're saying only you have to quarantine 5 days after testing positive. But, there are no hard and fast studies supporting that. So, basically they come up with that recommendation based on the anticipated surge in the Omicron, COVID, and the shortage of workers, and probably it was pushed by the big industries, like airlines, and which are concerned with the lack of workers. It's confusing for the general lay public to get this kind of mixed messages. Now, if you think about it, why is this happening? Of course, the director is coming out with all the proclamations, but I don't think she's personally responsible. I think, as you know, CDC is a big organization. So just like any other big businesses, after some time, unless you take really good care of the business processes, it can degenerate. You can get a business decay. So I think the CDC is in that phase of entropy, if you call it.
Mm-hmm.
So I have nothing against the people working in CDC. They are very smart people. They are very committed, dedicated. But somehow there is some disconnect between the, just like you said, messaging and what is happening and the work the CDC is doing. One of the reasons, of course, apart from the business part of the CDC, I think the academics, if you look at the papers, Kevin, I mean, for the last 2 years, there are not many COVID papers coming out of this country. I mean, why is this happening? Where is NIH? Where are the grants are going? I mean, there are a lot of questions to be answered. In the article, I also have like a graph saying the percentage of the papers coming out of US compared to other countries. If you look at that, in 1990s, we had like 30% of the whole scientific papers.
Mm-hmm.
But right now it stands at 17%. But other countries are catching up. So somehow our scientific establishment has to take the responsibility for the CDC's failures, because CDCs cannot act in a vacuum. They have to depend on the studies, and there are no studies. So, and then we have to depend on Israeli studies to get the COVID booster approval. So, I mean, these are the things, I mean, we had to go back and introspect and find out what's happening. It's not a question of finger pointing or finding fault. It's a question of going forward and making it right. So I think before doing that, we have to acknowledge that there was a failure. And then secondly, we have to study the processes. So what happened? What is happening in the CDC? What's happening in the NIH? What is happening with our grant processes? What is happening with the youngsters? Maybe the NIH grant process has to be completely revamped. Yeah. So my point was like, just by appointing a medical expert is not going to help it, because the process have failed. So in order to correct that, a business expert needs appointed as the leader. So like a sort of a double-headed leader approach, one person being a medical expert and other person being a business expert might be the way out.
So you talk about a few examples of the mixed messaging of the CDC. The first example was about masks in the spring of 2020, and another example was their 5-day isolation period after getting sick. So I'm interested in hearing your explanations for the reasons for the mixed messaging. Is it, like you said, the influence of business and politics? Is it the fact that the science is changing so rapidly that it can't keep up with the science? How much does politics and business interests do you think influence the decisions and messaging of the CDC?
Yes, very, very true. I think we had a very, very confusing politics at the, as you know, remember at the beginning of the 2020 when the whole pandemic started. So there are a lot of CDC has a lot of pressures, and then they have to act in a vacuum because they did not have any solid scientific evidence. So they were making decisions on the run, sort of. So based on, so to say hearsay, no hard facts. So basically in the beginning, if you remember, in 2020, they said masks are not useful. I mean, which is totally ridiculous. But they said that because they were afraid that if the general public used the mask, it won't be available for the healthcare workers. So the failure was our supply chain failure. Failure was the people who are making masks in our country. And recently I was driving through one of the auto factories, and then they proudly announced that we made 20 million masks this year or something like that. I mean, they did a good job right now, I agree, but they were a little bit, lagging behind the rapidly evolving a pandemic. So that is politics. The federal government has to be ready for such a pandemic, and we are totally not ready for such an event. And interestingly, about 2 years ago, there was a report, and I think the WHO assessed the pandemic preparedness for all the countries, and US was number one, and UK was number two. But even then, when it comes to the real thing, we were not prepared. We were caught off guard, and we dropped many balls. And I think that's one of the reasons CDC was forced to make those decisions. CDC, and also probably the process in the CDC, the messaging, and there might be some issues which needs to be looked into and corrected, because you should be a very nimble organization. I mean, as you know, when I was working in Oman, actually there was an outbreak of Congo Crimea hemorrhagic fever, which is a very rare case of hemorrhagic fever. And the case fatality rate was only like 5%, but still people are concerned because it is coming from the cattle, and people will have thrombocytopenia, severe bleeding. And actually a CDC team came and then they pinpointed the origin of the epidemic, and then they actually helped in controlling it. It happened very quickly. So what happened to our CDC after 20 years? We are not ready to stop the pandemic even after 2 years. It's kind of disheartening after spending, a lot of resources.
Now, in the middle of the pandemic, there was a change, of course, in administration. What's your assessment of Dr. Rachel Walensky's messaging? Has there been a significant improvement in the messaging after that change in administration?
Yeah, I think Dr. Walensky is very sincere in trying to improve the messaging, but just like I said, the issue is not the messaging, but what's happening. What is it basing on? What is the CDC? What's happening in the CDC? So I think we are almost back to square one because of this kind of situations. But again, the hard reality is that within the last 2 years, we don't have any substantial studies from the US. We are not keeping pace with the science, and many other studies are coming out of other countries which are not done in a very scientific rigor, and then they were giving us false information. So the whole thing became very confused. So I think Dr. Walensky needs some help. She needs some managerial help to figure out what's going on inside the CDC and probably work with that person to correct the processes happening in the CDC. And also, there should be a hard look at what's happening in our country about the scientific publication of the articles. If you look at it, I think your blog is actually more current than many of the medical journals because people are writing. So when you follow KevinMD.com, I mean, you can get a current sense of what's happening with the COVID-19 much better than if you read a medical journal, because medical journals have a lag time. So, so the information is only there after I don't know, 3-4 months. But I think there are so many things to be fixed.
We're talking to Dileep Kumar. He is a hospitalist. He wrote the KevinMD article, The CDC's Continuing Failures. Is there a way out? Dileep, one of the solutions you mentioned was having a managerial or administrative lead in conjunction with the medical lead. So go into more detail about that, and how would that look like?
In practical terms, it has to be like really two people working together. So one person will be taking the medical decisions. Because right now, we are probably asking Dr. Walensky to be in charge of the whole, because it is like a big business, like 15,000 employees and different departments. So somebody has to look at how the inside of the CDC works. How are the different departments interact together? What is the business structure? So, I mean, we need to have somebody who is experienced in business reorganization, so to say. So that person can advise the medical lead, and they need to work together so that CDC will work like a well-oiled machine. So, I mean, again, it's all going to be a work in progress. And I think the main thing is to find two people who are very smart in their own disciplines and able to work together.
And my final question, what are some of your take-home messages that you want to leave with the KevinMD audience?
In these difficult times, I think burnout is a major issue among physicians. I think people, went through your articles, and you can also find so many clues and so many tips. So I think my recommendation is to look beyond the clinical medicine and find out what's happening, or try to understand the processes, try to understand the people, and then try to contribute in that way, and always support each other, because that is the best way, one of the best ways to prevent burnout.
Dileep, thank you so much for sharing your time and insight, and thanks again for being on the show.
Thank you. Thank you, Kevin.